Now, one expert believes veterinarians are experienced in dealing with animal pandemics and they should be roped in to help with the fight against COVID-19. Head of Department of Production Animal Studies from Pretoria University, Rebone Moerane, joins us now live. Rebone, thanks for your time. We appreciate it. So you reckon vet specialists could actually help in the fight against COVID-19. Some might find that odd, but that's not the case, right?
Good afternoon, Sean and viewers. Yes, indeed. If you consider that diseases can easily be transmitted from animals to human beings, and as I've said also in my article, that research indicates over 70% of disease in humans originate from animals. Now, when you have a situation like this with the pandemic and some of the experience that is available within other professions, I think it's important that the NCCC and government should look at using the expertise from other professions. Now, the other issue is that we keep on speaking of One Health, which looks at human health, animal health, and the environment. Now, it is high time and opportunity now that get all this expertise from various professions to sit around the table and help with this pandemic. We are all of us have been affected somehow by this pandemic, and we need to bring our expertise on the table to assist in the country in the control of the disease.
Yeah. So you say it's unfortunate that the Health Department and the National Coronavirus Command Council did not ask for your input. What would you have done differently?
Well, if in the first place, using our experience as veterinary professionals, we would have tried by all means to try and contain the disease when we realized that we had a new strain. And the way ideally to do it is try and contain it within the areas where there is an outbreak, right? And it could have been that raised the level in the affected provinces. At the time, we had Eastern Cape, Western Cape, and KwaZulu-Natal. So we could have raised the level to level 4, level 5, and try and do a lot of testing and surveillance in the area and try to contain the disease in those specific areas, while at the same time implementing the other measures that have been implemented so far. Your distance, social distance, using the mask, make sure everyone wear masks, and washing hands and so forth. So we would, in a way, while we are also waiting for the vaccine, try to contain the disease, and we could have limited the impact in the rest of the country.
So let's go through some of your other suggestions you wrote about. Let's start with the vaccine rollout. What are your thoughts on government's plans? Well,
if we look at the current plan, my concern is that if we implement it by the proposal from government to say first phase is to vaccinate health professionals, I do not have per se problem with it. However, that will not assist in a way in containing the disease. It will still spread all over. Now, already we know where are the hotspots, right? And we should be focusing on vaccinating around those areas to contain the disease. But at the same time, we know also areas, as I've suggested, mining areas, where a lot of people come from various provinces, and there's a high population in those areas. So focus on such areas to try and contain the disease, while at the same time, you know that with the second phase, you can go in another area, 30 to 60 kilometer radius around those zones. Then it can be followed by vaccinating the rest of the people in the country. So it's got to be specific targeted areas that we focus on.
Yeah. And of course, you know, there's been lots of complaints from healthcare workers about the conditions they're working under. You've also made a suggestion about an all-in, all-out system whereby only specifically identified healthcare facilities are allowed to enter a ward. How would that work?
Well, if we already know that in these specific wards where they have COVID-infected patients, right, that it's also a source of infection. Now, to help in reducing the possible spread, and making sure that the same people working in those wards, as we know that they'll be going home, though there's still a chance that they will take the virus and obviously infect, or they will be infected themselves, or even infect their families back at home. So we have to look at improving what I would say biosecurity measures in these facilities. Now, there are a number of ways besides what has been implemented so far. Firstly, I would not allow any health practitioner or a nurse or doctor to go into those wards wearing their own personal clothing. They'll have to shower in and shower out and change clothing as they go into proper protective clothing. And as they leave, they change, they wash, shower, and then change into their normal clothing. So there are a number of aspects that we could look at and we could advise and discuss around the table, of course, with the medical practitioners in terms of how this could be improved, right? The other aspect that we need to be looking at is, yes, it's good that government has had these facilities, the tents being put up where they've got a lot of COVID patients in there. But we need to be asking ourselves as well that having a big tent which is not partitioned, is it the right way to go? Or should we ideally look at some sort of partitioning some of these areas, right? Have an entry door and have an exit side. Now, this will allow that you have got specific number of patients in a particular ward or section. And as the people recover or they go out, you also disinfect that area. You do not continuously bring people into an area that continuously has a high load of the virus in there. So there are a number of suggestions that we could sit around and discuss and look at.
So there's been a lot of contention around Ivamectin. What's your input on that drug? Because we know that it's been used on animals, and there are many people saying it's safe to use on humans, but the FDA and stuff like that saying they've only tested and approved it for animal use.
Well, my point would be allow SAPRA to look at all research and articles that have been published with regards to the use of Ivamectin in human beings. And based on the outcome that they come up with, they can guide us in terms of whether we can use it. Because my challenge here is that you're using something that has been tested for use in animals, and then people want to use that in human beings. There could be massive major implications or side effects that possibly we might not be able to deal with. So we need to be cautious about taking something like that and just using it. Let's allow scientists to do their work and come up with resolutions in terms of saying, yes, we are satisfied with the outcome of the trials and the articles being published indicating that it's safe for use as it is.